All right, welcome everyone to Spine Conference. Today's discussion is going to be just a little bit unusual, not too weird, but it's just a generalized topic of excellence and reliability in spinal surgery. So, spinal surgery is a very serious thing, and you would think that we would be both excellent and very reliable in it. So we're going to start, like all things, we're going to start with ancient Greece because that's where civilization started. And my favorite hero is, or myth, is Hercules. And this is a depiction of Hercules with the Nemean lion. He was a lion that was terrorizing the countryside. That was his first labor. Then Hercules went on to perform at least 12 labors. These are the 12 labors that he had a compact, or he was contracted out by the gods to finish these labors for something he did. He did a small thing. He got angry and killed his wife and child. So the gods decided, in a fit of fury, to pay back. He had to do these 12 labors. And he did even more than that. He was a very prodigious person. He accomplished a lot of feats. And I would say he was a person of excellence. I mean, he always did great feats, like he cut the Hydra, the seven-headed Hydra. He captured a big boar. He brought Cerberus back from the dead. So he was an incredible character. Now, why am I talking about Hercules, right? This is spine surgery. Well, as a young man, this is a Renaissance painting of the event. As a young man, on his way, as he was growing up, he came across two women, and they were both deities. And they both wanted Hercules, basically, to join them. So that's the ancient one, but this one makes more sense to me. This is a current drawing that somebody did from Mexico, an artist from Mexico. And the two deities were Arete and Kakia. So what's Arete? Arete in Greek is the relentless pursuit of excellence. And Arete was a goddess, and she was very plain, very mild person. And she said that if Hercules followed Arete, or the relentless pursuit of excellence, the journey would be very hard and tough, and he would achieve greatness and glory, but way down in the future. And then the other deity was Kakia, which in Greek, the definition is badness. And Kakia was beautiful. You can see she's decked out. She's ready to go to the disco club. Very pretty. And her path was immediate wealth and immediate pleasure. So which path do you go? David? Well, I think my take on it is he went, obviously, Arete's path, but just in case he got Kakia's telephone number.
There you go.
Okay, so Arete the relentless pursuit of excellence is an ancient concept, especially in Greece, and the ancient Greeks felt that was part, like the pursuit of excellence was part of achieving a life well lived, which is our goal. And Aristotle's thoughts on excellence was, the quote is, "We are what we repeatedly do." Excellence then is not just one act, but a habit. So it's just not excellence. It's just not doing something well once, but it's something that you do all the time, and you try to. People who are excellent do it in all aspects of their life. So, what is reliability? Reliability is an attribute of any system that consistently produces the same results, preferably meeting or exceeding specifications. So excellence is above the average, and reliability it happens all the time. And in surgery, I think safety is a big part of being reliable. And also, if you can't get safety right, I don't think you can get anything right. Like that's a bare minimum. It's just like, for men's, like just shaving in the morning. It's something you always have to do, and it's very important. So it brings us to us. This is our surgical team, and what do? Like, I'm a surgeon. So what is a surgeon? I'm just an educated person who helps people with medical problems. And my specialty is surgery, is helping them with a surgery, not with a medicine or something else, but rather mostly surgery. So how do I take care of people? Well, they come to me in the office and I see them, and the things I do is I ask them how old they are, and I ask them exactly what is their problem, always in their own words. And then I get their history. They tell me their story. And then I also get their background, past medical history, past surgical history, the social history, what medicines they take. Then I carefully examine them. I look at their bodies. And then I review x-rays, MRI scans, do tests that look at the spine, because my specialty is spinal surgery. And then I come up with an assessment, options. I tell them, well, you can do this, you can do that. And then the two of us come up with a shared decision or plan. So that's what I do. And I think it's critical, this is a quote from Marcus Aurelius, that you should always look to the essence of a thing, whether it be a point of doctrine, practice, or interpretation. So you should try to understand, what am I doing? What is the problem? What is the pure essence of what's going on, in this patient? And don't do things by rote or by what you've always done, but try to boil things down to what you think the essence of anything is. I think that's critical in what I do. And what do we do in the office? We observe very, very carefully. And that's part of being a physician, I think. You just look at people and things, just observing them. It's just not just blindly just looking forwards, but watch them carefully. And then listen very carefully. So listening is a very active act. You have to constantly listen, interpret, and carefully listen to what they're actually saying. Not what you think they're going to say, but what they're saying. And the other important thing is the power of a story. So this is a book that I read that I think is a great book, The Power of Story. But story, I think as human beings, we're hardwired to love stories, and the stories are super important to us. It's about what we are. So, and the stories, there's the power of story. There's a couple things. First is each person has their own narrative or their story, and they have to tell you that story, and you have to listen to that story. It's so important to them. Also, every person has their own story, like a mission statement. So a company has a mission statement, like, for example, a big corporate or Upper Chesapeake's mission statement. Like, we want to do the best of medical care for our people in this county using the best techniques. I mean, that's the hospital story. And each person has their own story, too. Like Jessica, once, what's your story in your life? Do you have a mission statement? You're going to nursing school, and you want to help people. And be employed, and that's kind of like your story. So stories are super important. Also, stories are important to explain a problem. So patients need a story. They can't they have a hard time. Like when bad things happen to them, or their back hurts or whatever, they have to have a story about it. They even make it up if they have to. Say, for example, I shoveled my sidewalk, and then 3 years later, my back started hurting. Well, I don't think that shoveling the sidewalk had anything to do with the back pain. But the need for a story is so great that they just have to create it. So we kind of confabulate a little bit as human beings, if you think about it. And it is quite natural. They're not lying to you, but it's a natural desire that we have, is to have a story. And we need a story to understand our world. So it's hard to, like the book of Job. You guys know the book of Job? So Job came down with boils. All of his children died, and God took away all his money. Actually, the devil did. And he couldn't deal with the fact that all these bad things happened to him with no meaning. And then in the book of Job, God came as a whirlwind and said, that's it, I'm God. You can't understand me. And so Job had a really hard time dealing with that. He needed a story. It's like a very important part of our lives. Okay, so then we think about things. And the other important thing is, when we ask questions, don't ask leading questions. So it's a lot cleaner if you ask questions that are not leading. So what's a leading question is like, one is, you hacked into John's account and copied his essay, didn't you? And it's like you're like sort of forcing the issue, like they did do that. Or another thing is like, we're doing the right hip, aren't we? So that's like the worst way to ask which side you're doing. And it's the worst way to ask it. So a much better way to ask is, what are we doing today? And then the patient would say, I'm doing a hip surgery. And then you say, good morning, come on in. And then another way, then you go on, which side are we doing? and then they say right or left. So you don't lead leading questions. Does that make sense? So before every surgery, I try to avoid a leading question, and I say, "What are we doing today?" And they say, "Well, surgery, don't you know?" "Yeah, I do." And I always have the consent sheet in front of me so they know that I know what I'm talking about. And then I say, "Please tell me which side we're doing." So you don't ask a leading question. It's very important. And in history too, it's the same thing. Now, after I see patients, I evaluate images. Usually it's X-rays. And usually more images in the form of an MRI. So we all know here an MRI scan is a big magnetic tube that we go in that gives these beautiful images of the body and can evaluate soft tissues incredibly. And specifically in my field, I'm just for the sake of argument, we're just using the cervical spine today. So you can see the spinal cord and the vertebral bodies and the discs, and this is a cut in the sagittal plane, and then on the axial plane you can see the spinal cord, the disc, and here this person has a disc herniation hitting the frame and the nerve. So I evaluate all these images, and then I come up with a understanding of what's going on, and I explain to the patient as best I can what's going on. So I think that's part of my job too, is to explain things, and it's a lot of work to explain things in natural language. So it's very easy to say, "Oh, you have a C5-6 cervical disc herniation with neurological compression." I mean, that's not what the patient wants to hear. The patient wants to understand. So I have a model in the office. I say, we have these bones in our bodies, and everybody knows what a skeleton is, and this cartilage, and a piece of that cartilage is hitting a nerve which runs down your arm, and you have to explain it. It's part of your job, and it's very important. Things always don't work out perfect. Like, the world is not a perfect place, and I try to remember the words of Leibniz that if there were no best among all possible worlds, God would not have created one. In other words, you can't always say that this is a bad world and what are we going to do, the situation's not perfect, whatever. The world is probably the best possible place it could be. I mean, and you just have to accept it. And if there is an omniscient or omnipotent God, you always say, "Oh God, why can't things just be perfect? Why couldn't God made this perfect?" Or whatever. It's like, it's probably the best it could be. It's probably the best of all possible worlds. Just a little bit of philosophy to help you through the day. So let's just do one case.
We're impressed.
So let's just do one case. So today's topic is excellence and reliability in surgery. A little bit philosophical. So let's just do one case. You kind of get an idea of what I do. It's a 75-year-old woman with pain and ataxia. She couldn't walk well. She had left arm pain. The x-rays show some spurs in her neck. And then she comes in, mostly the pain was running down her arm, was terrible. She took medications like ibuprofen, time, therapy. Nothing was making her better. So on the MRI scan, she had 2 disc herniations pushing in on her spinal cord here and here. And here's her spinal cord. And she just couldn't take the pain anymore. And on the axial cuts, the spinal cord should be a circle like this. And at those 2 levels, the spinal cord is compressed here and here, somewhat here. And the surgery was to the front of her neck, removed the pressure off the spinal cord, where the discs were. We filled it with a piece of bone from a dead person, and then a plate and screws to hold things still until the bone heals. The surgery is done through the front of the neck. It's the safest way to completely remove the disc. You make a skin incision, then you cut through a very thin muscle called the platysma, and then you have to go through a certain path, and you avoid the artery to the brain, you avoid the windpipe, the trachea, you avoid the esophagus. You retract these tissues to the side so that you can get to the disc to remove it. You expose the disc, and then during the surgery we use a high-powered microscope which makes things super magnified, somewhere between 8 and 12 times magnification. It also allows 2 people to work at the same time, and both people can see everything at the same time. And there's super powerful light, very powerful fiber optic light. So the visualization is just absolutely incredible. I was going to show a video, but you guys interested in seeing a video? You guys seen my videos, right? Want to see it?
Sure.
Okay. Let's see here. Oops. Copy. So any questions while we're doing this? Give a second. Power of YouTube. Actually, I could have just done that. So this just shows the X-rays and 2418. This is all through the microscope. Doesn't want to go. Aaron, am I doing something wrong? I want it to go right here. So that shows you, this is through the microscope, and that's the kerosene punch, and this is the vertebral body on either side, and most of the disc has been removed, and that's a little kerosene punch, and the white thing in the middle is the spinal cord itself. You can just barely see it. And this is the most critical part of the surgery, where you're removing the very last remnants of the disc off the spinal cord. And I'm using the kerosene punch, and that thing you're seeing waving back and forth occasionally is Erin. She's my assistant. And she removes the material off the instrument, sometimes with the sucker, sometimes I have to do it with my hand. She tries to do it with the suction because that makes it a lot faster. And you can see the spinal cord there. And you can see how everything is magnified. That kerosene punch is 1 millimeter punch. So that, hold on, let me get a good view of it. This thing from here to here is a millimeter. So you can see how things are very magnified. And the point of that is you're able to do very precise things using the microscope because of you can just see so well. So the next one's at 40 and 128. So then let's go to 40 minutes. Once the disc is completely out, there's a big defect where the disc used to be, and you can fill that. There are many options to fill it. You can use polymethyl. You can use PEEK, polyethylene. You can use there's some metal implants. There's you can use different types of bone. I like to use you can use iliac crest from the patient themselves, which is like sort of like the old way, tried and true way. I feel that this is the allograft that I use. It's a cortical cancellous composite. The outside is cortical bone, a very thick bone. The inside is cancellous bone, like from a tibia. So I think it mimics basically your own vertebral body, and it's from another person, so you don't have to cut it out of the patient. So it's a lot easier, and that's just tamping it into place. So then the bone fuses between these two areas. You can see how everything is. You can see everything very well. And then at the very end, we put a plate and screws on.
Now you removed half of the disc.
All of the disc.
Both sides.
Yeah, the whole thing. The whole thing from a front approach. And then at the end, we put a plate and screws to hold everything still, so that all the bones heal. This is kind of it's called the anterior cervical discectomy fusion. It's kind of like a typical case surgery. It's through the front of patient's neck. And you can see how accurate we can be with these. I mean, this screw is a 3.5 millimeter diameter screw, so you can see how well we can see. It's quite amazing. And the microscopes have gotten much, much better than they used to be. They're very easy to drive. Okay, back to the show. So I'm a student, like all of us are kind of students. So I always want a book and a rule book, and how do I do things? I want to read about it, and I want somebody to tell me what to do. That's always what I've done in my entire life. I read constantly, I learn constantly. So there's one thing that I think is very important in life. This is a quote from F. Scott Fitzgerald, is that the test of a first-rate intelligence is the ability to hold two opposed ideas in the mind at the same time and still retain the ability to function. So in life, there's a lot of gray areas. So, and you have to constantly weigh two things at the same time, and they can be in opposition to each other, and you have to be okay with that. So, when you weigh these two things, you have to find a balance in some manner. So, can someone come up with an analogy of two different things, like let's say the coach with a quarterback. I mean, he's got the main quarterback, Joe Flacco, and then he's got his second string, Tyrod Taylor. And Joe's doing horrible, so the coach is like, what do I do? There's two things going on. I got the old quarterback's not doing well. I got a young quarterback who wants to establish himself. What do I do? There's like two different ways. And in life, you don't know. It's a very common problem. So that's one. We'll get back to that. So how are you reliable and excellent in surgery? Well, I think practice is very important. So to get good at anything, you really have to practice all the time. And it's repetition over and over and over again. And as surgeons, we do a residency. And during my residency, I think I did like 2,500 surgeries. And just over and over and over and over. And through the repetition, you just get very good at it. And then at some point, your brain changes in how it does it. The ability to perform an action goes from more of the frontal lobe to more of the parietal lobe, and they call it as clumping. Like the action is clumped. So, for example, say baseball swing. So when you're a kid, you're like, okay, feet go together, bend the knees, bat up, elbow up, relax, deep breathe, bat back, swing, level swing. I mean, all these things, right? You remember all the steps? But then at some point, you redo it so many times, you don't think those things anymore. You just think baseball swing. And you do all of them. And then it goes from the frontal lobe more to the parietal lobe. And then you go to another level in the brain. And the brain can do that. And the brain's unbelievable. I mean, that's like an incredible thing that you can do with your brain. So we do that in surgery. Another important thing is consistency and routine. Is we do things the same way every single time. And hopefully you do things right. And then you don't stray from this consistency and routine, and you do a very good job every time. So that's a very important thing in surgery too. And the other thing is you do what you're taught. And the Romans had a way to explain this as mos maiorum, where basically the ways of the elders is, this was the Romans had a code. It was basically traditionalism, and it's the collective time-honored principles, behavior models, social practices that have affected their private, political, military life. So you do what we always do in society. And the reason is it's worked in the past. And so you stick to what you've learned. Now, is that always true? Obviously not. Another quote to remember is from Ralph Waldo Emerson: "A foolish consistency is the hobgoblin of little minds." So it is very good to be consistent, but not in a foolish manner. So I know that it's two different things at the same time, but you have to remember that it is very, very good to be consistent, but also not at the detriment of doing something wrong or something that could be better. So what do? Is I try to be good. I try to avoid complications. So Charlie Munger had a statement. He said it was from a farmer. As the farmer said, someone came to the farmer and said, we grant you one wish, one piece of knowledge. What do you want? And the farmer said, well, I want to know where I'm going to die. And the magical fairy said, well, why would you want to know that? He said, because I'm never going to go there. So the other thing is, I remember when I got my life insurance, a nurse came to my apartment then and asked me a million questions. Do you do drugs? Do you rock climb? Do you get into fights with strangers? And I thought to myself, you know what? Just keep that list in the back of your mind. Never do them, because that's how you're going to die one day. So just try to avoid bad things, and if you can avoid bad things, you do very well. So our risks of bad things are bleeding, infection. We have paralysis. Everything that we can do to avoid these things. It's always on my mind. Damage to the esophagus, trachea, artery to brain. There's a lot of bad things that could happen in surgery, so we're constantly trying to avoid these complications, and we're thinking about it. So another roadmap to doing well, I've sincerely enjoyed Stephen Covey's book of The 7 Habits of Highly Effective People. I thought it's a great book. But I went one step further and I looked into the ancient people, and because Rome was an extremely successful society, and how were they so successful? Well, they sort of had the 7 steps, but they called them the Roman virtues. So I researched them and I wrote them all down on a PowerPoint presentation, and then I made a plaque and I stuck it in my bathroom. So every morning when I wake up, I pick one and I say to myself, I'm going to try to do a good job in this one Roman virtue. And I think they're great virtues. We're based on Rome, so we'll just pick a couple. Like I was telling Aaron, comitas. Comitas is like ease of manner, humor. Some are obvious, like firmitas, which is tenacity or perseverance, never stopping. Frugalitas is frugality, which you think of mostly frugality, not spending money, but it's more than frugality. Like, say, frugality in all things. Like, for example, you don't want to use an elephant gun when you could just use a pea shooter to kill a fly. So you should be frugal in all your things, in your speech, in your mannerisms. Try to conserve things and be efficient, basically. Other things like justice, industria, being industrious, veritas, being honest in your dealings. Another critical part of being successful, I think, is constant vigilance and attention to detail. So you not being sloppy and always forward thinking. So I'm constantly thinking forwards of what's going on in this surgery. Am I going to need an instrument that we don't have in 10 minutes or an hour? I think forward to the patients. What's this patient going to do? Is he going to do something bad? Is he going to create a problem? I think forwards in the day. I think forwards in the field of orthopedics or spinal surgery. What's going to happen to this patient in 10 years? Will there be something new? And I think forwards in the society. So I think that's important. And the other important thing is constant focus on the current task at hand. So sort of isolate yourself and just make sure with what you're doing currently, you're going to do a very good job. Because the best way to get more business is to do a great job on what you're doing currently and just focus on that one patient, that one surgery, whatever you're doing at this point in time, do a good job with it, which goes back to Aristotle's concept of excellence. It's constantly being excellent. It's a habit. The other thing I always think about is be both accurate and precise. So with the microscope, we're very accurate. We're down to the millimeter removing the tissue off the spinal cord. But are we precise? Are we doing the right disc? Are we doing the right surgery? That's very important too. So you could be perfect, but very extremely precise, like here, but you're not hitting the target. I mean, every single time you're exactly where you should be, but so you're very, very precise, but you're not accurate. And here you're both accurate and precise. And here you're pretty accurate, you're pretty close to the center, but you're not precise. And here you're neither, you're just all over the place. You're neither accurate nor precise. So you want to be both. So I think first you have to get accurate and then you have to get precise, but I don't know. And the other important thing I think is doing well is default. So you should always think of what is your default. So what's default? When you open the screen in the computer, it goes to one thing all the time first. And you have to see yourself as what is your default for many things. Like, for example, I try to always have my default to be the best possible thing that it could be. Like in the mornings, my default is I exercise. If I don't exercise, that's not normal. So that way I'm always exercising. And you can do this with your patients. Your default is you always do a good job with every patient. That's your default. And then the important thing about excellence is there's got to be feedback. So you can't just do something and not measure what happens. For example, many surgeons do surgeries and they never see the patient afterwards. Somebody else sees the patient. Well, how are they going to know how well they're doing? So that's why I think it's always critical that I'm there, that I get the bad news, that I see the bad news, so that I get better and that I measure things. And so you have to, just fixing a problem, you have to know what's wrong, figure it out, make an alternative, do the surgery, and then you have to see if it worked or not. It's very important. Otherwise, you're never going to get better. There's got to be a feedback to everything. And I also do this, the SF-36, which is very humbling, which is a short form of 36 questions, which kind of shows how are people doing, and it was created by the Rand Corporation. It's sort of like does anybody else use this? You guys? It's sort of a test of how you're feeling. A lot of it's mental though, so it's not for orthopedics. It's just a generalized test of people's general health. But I do use it.
They use it in therapy a lot.
Yeah, it's a very, very common tool. And one thing I use for feedback is the hospital said as part of my part-time employment that I get a bonus, and they didn't say how they're going to do the bonus. So I offered a bonus that is per my complications. So the more complications I get, I don't get a bonus. So for me, it was sort of like a trap. It was a little trap for myself that I have to be good. So it's sort of like a feedback. And my complications are dural tear, deaths, re-surgeries, neurological injuries, things that are relevant to the spine field. Okay, so next is like teamwork. Like teamwork is very important. So you can think of a beehive. That's probably the most incredible teamwork ever, where every bee has its little job. And I always think of the story in leadership of the tragedy at Mann Gulch, and I sent this to Aaron, where in 1949 there was a forest fire, and they sent 13 firefighters died on that day. They sent a team of firefighters that parachuted into the fire. Unfortunately, the team had never worked together before, and they're young people, and the leader of the team was a totally new leader. So it was a huge disaster. So what happened is, and this is just a story about the importance of a team. The men landed. They went to fight the fire. After a short period of time, the leader, who knew this was a serious problem, and he also had lunch, he decided he's going to stop for a second, just relax, eat lunch, and just think. But the people who were following him didn't realize that the leader was very, very concerned. And they thought the act of eating lunch meant everything was fine. And they didn't know this guy. So the people on the team thought things were doing well. And then the leader found that this is horrible, we're all going to die here. So the leader yells, drop your tools and leave. We have to abandon this fire. But the firefighters, they didn't know this guy. They didn't realize he was very serious, and to them, dropping the tools was giving up, and they didn't want to give up. Some of them didn't drop their tools. And then as the fire was about to engulf them, the leader made a fire himself and told everyone, jump into the fire with me. And the firefighters didn't know what to do. They thought he was killing himself. They didn't realize what he was trying to do was to make a fire. It removed all the brush in a certain area, so then the fire just basically goes over that area. And he saved his life, but his team didn't follow him. They just ran for it, and everybody died. Now, why am I telling you this? I'm telling you this because the teamwork is extremely important, and it's also important to have the same team all the time, and that you work together, and that you know each other. So that was one example where it was a very bad situation where people died just because they didn't know each other, and they didn't know how to work together. So we work in a hospital. This is our team. So we have two teams. This is the team in the office. Aaron's the physician assistant and my staff. And this is the team in the operating room. So there's two teams. And in the operating room, the person who hands me the instruments is Brittany. And I have her every single time. And we had a big fight in the operating room because the administration doesn't want to have these teams because it's a hassle. First of all, everybody wants Brittany because she's great. But also, there's an administrative thing where they have to it's hard for them to make the schedule if you have to have teams for everybody. They'd much rather everybody float around. That way they can fill holes constantly. But having the same person is incredibly important, just like the Mann Gulch fire. Everything works so much better when you have the same team. And I told you, this is my brother. My brother had the best compliment ever from Brittany. That's my brother at Easter time. We dressed him up in the Greek hat. He said that while he worked once with Brittany, he said, she said, this woman is handing me instruments that I had no idea I could use and are very useful. I was like, yeah, that's her. She's incredible. And what she does is, Brittany doesn't know how to do spinal surgery, but she's very good at patterns. and she knows my patterns all the time. Okay, at this point he uses this, at this point he uses that, he never uses this. And we all have pattern recognition, and it's individually but also collectively. So Aaron knows that I never do that. Why are you doing this? You never. Oh, that's right, I never do that. Or so we all work together all the time, and we have all these patterns, and it helps us keep us from making mistakes, basically. The rest of the team is our circulator, who's great, and then the person who puts us to sleep, the anesthesiologist. And that's Erin. She's the assistant. So how do you make a team? Well, Warren Buffett explained in one of his lectures is that 3 important things are the people on your team or your partners. It should be people that you like, admire, and respect. So it's a very, very, if you can have all 3 of those things in your partner, it makes a great relationship. And then these 3 are extremely important too in having someone on your team: intelligent, industrious, and integrity. And the important thing about these last 3 is if they don't have one, the other 2 are going to kill you. So for example, if you have somebody that's very intelligent and very hardworking and industrious, but they have no integrity, they're just going to destroy you. It's a constant war. Or if someone's not intelligent at all, but very hardworking but integrity, they're just constantly going to make mistakes, etc. And then someone who's very, very intelligent, great integrity, but they just don't work at all. No industry. So you can see how if you don't have one, the other 2 are going to kill you. The other thing I think important about a team is that it has to be comprised of a coalition of the willing. They have to want to be on the team. So, and I think that's important that people are happy where they are, because not everybody likes everybody else. Like some people don't like me, and I don't like some people. So you have to, when you have a team, they have to want to be together.
You guys type of that.
Hmm?
Compromised instead of comprised.
Compromise?
Did you see? Take another look. Compromised.
Oh, sorry. Yeah.
Not important.
Yeah, that's kind of funny. The other thing about a team is there's got to be somebody in charge. So maybe a dictator. And the best groups are always benevolent dictators. So, and Plato said that too. The best political organization was a benevolent dictatorship. And everyone says, oh yeah, as long as I'm the dictator. You know, you don't want to be under somebody else dictator. And what does that mean by that? So let's say you have a committee. It's really hard to get anything done when everybody's in charge. So it's very important to have one person in charge. But that one person that is in charge has to be somebody who's benevolent. So what does that mean? It's best when the person who's in charge is very open to new ideas and is constantly promoting a devil's advocate, is constantly, like for example, in Kennedy in his administration, he had one person that his sole responsibility was to make a plan that was opposite their current plan, to try constantly being the devil's advocate. And that way you make good decisions. So this is a example of when leadership failed. So this was the Korean, I don't know if you guys remember this, the Korean air cargo flight that crashed in 1999 and everyone died. The crew died. It was a 57-year-old captain who had 8,000 hours of experience. So this guy is super experienced pilot in charge. And the first officer was only 33 years old. It's a big difference in age. And he only had 200 hours of experience, almost no experience whatsoever. And there's a hierarchy. The pilot's in charge and is over the first officer. What happened is the pilot was making an incredible error, a fatal error, that they all died. And the first officer knew that he was making an error. But he was sort of embarrassed to bring the error up to his boss because he thought the boss knew what he was doing. And he didn't say anything. And by the time he brought the mistake to the captain, it was too late. And when they reviewed the transcript, they realized that he knew what was going on, but because of the hierarchy and the fear of the person underneath the leader to say something, everyone died. So the point of this is it's very important for people to speak out when they think something is wrong and basically tell the leader he's wrong. And if that's not the case, huge mistakes happen. And they worked on the Korean Airlines, and that's been fixed.
Part of that is the culture in Asia. You don't dispute what your elders are doing or saying.
Right.
Yeah.
We have that too a bit. So that's what Team
Not
Steps
so much,
do.
yeah.
In Team Steps, though, that was the point of Team Steps, is to stop thing. So when did Like, when can leaders do something bad? I'll tell you what happened in my operating room. This is kind of a funny story. Is on August 23rd, 2011. Remember we had the earthquake, which is unheard of. We don't have earthquakes, and the earth shook here in Baltimore. Never happened. So where was I? I was in the operating room under the microscope, and the whole room started shaking. So what did I mean, what's the first thing that came into my mind? What would you think if when the microscope started shaking, Aaron? The patient's awake, right? It happens. So I was furious. I screamed. I was like, will you please put the patient back to sleep? How do you expect me to work? So the anesthesiologist, of course, yeah, right away. He's like, I don't get it. He goes, Spiro, the bed is moving. I was like, will you stop messing with me? This is serious. Come on. Yeah, I'm sorry, but I think the bed is moving. I was like, are you crazy? I was like, we don't have an earthquake. The patient's waking up. And everybody kept saying they just couldn't understand it. And I basically, because I was the leader in the room, convinced everybody that the patient was waking up. I was wrong. There was an earthquake. And he did some medicines and everything stopped. And we just kept operating, and everybody was under the false assumption that the patient woke up, and that's why everything was shaking. Although the scrub tech says to me, Spiro, the table is shaking. And I said to her, we've got a job to do, and let's focus and stop messing around. It's like, so, and then the nurse came in the room and said, did you guys feel the earthquake? And the scrub tech said, I told you it was an earthquake. So that gives you an example of how, the leadership can go wrong. Another interesting point is, in Toyota, any worker along the line can stop the whole line if he thinks there's a safety issue. So that's what they do in Toyota to encourage and tell people, you have to stop everything. You have to speak up, and if there's a safety issue. Now, why not? Why are we so opposed to that? Why are we so opposed to people speaking out and telling us the truth or stopping us? Well, I think Machiavelli said it best: is letting men understand that telling you the truth. It says it's important to guard yourself against flatterers by letting men understand that telling you the truth doesn't offend you. However, when everyone is allowed to tell you the truth, the respect for you lessens. And Machiavelli, he's right. And if you go on to read the rest of this, it's very, very true. So Machiavelli felt like only trusted advisors should be able to tell you the truth. Otherwise, people don't respect you. Another important thing about teams is Dale Carnegie's book, which is a great book, and I've read it like 3 or 4 times, is working with people. There's a way to do it. And I won't go into all of it, but it's important to know people's names. It's important to really listen to people. It's important to respect people. It's always important to allow people to save face, even patients. Like, for example, when I give people medicines, I see them back and follow up. I used to tell them, did you take your medicine? And they say, no. And they're so, they total loss of face, like, why? It's a weird relationship. So I say the question in a way I feel that allows them to save face. I was like, were you able to take the medicine that I gave you? So that allows them to save face. It's like, no, because, it's a different relationship. So always try to let people save face. It's very important. And also, when people do a good job, praise them. Tell them they did a great job. Also, in a team, always have a high bar for both yourself and everyone else. So when someone does something bad, say, look, you're better than that. You're a good person. You're a strong person. You're smart. That's not like you. Always have a very high bar for yourself and for everybody else. And the other thing is, when you like somebody, you tell them. Like Robert Capa says, he was the photographer, the war photographer who was at D-Day. He used to say, like the people you shoot and let them know. And tell people you like them. And I also do with my family. I tell my family I love them. You usually don't say it, but you should all the time. It's important in relationships. Also in teams, there's got to be structured communication. There should be constantly back and forth with everyone. And I try to do with Aaron is like when we're doing a surgery. This is one example. I was like, Aaron, do you think we did everything well here before I close up? Because Aaron maybe is thinking, yeah, that you missed that thing. And from her perspective, she sees there's some more disc material hitting the spinal cord. And she has to be comfortable to be able to say that to me. So I always do this in a structured manner. I always say it. And also when things go bad, you have to give feedback in a nice way. So you just don't come out with it like, Jessica, that was the worst way you ever answered a phone. That was horrible. That you don't do that. You can say it, but you start it out as a sandwich. And Johnson & Johnson, they call it a sandwich. They say, look, Jessica, usually you do a great job. I mean, you do a really good job. But when you answered that phone, it could have been better. And then followed up with some more praise. And the reason is people never remember the middle of anything. So and any time there's any kind of communication or anything, the middle part, people don't remember. They always remember the beginning and the end. So that's why in the beginning, you always have a good first impression. You have a conversation, which could be horrible. And at the end, make it good. Like, don't leave in a bad way. And people don't remember the middle part usually. The other thing is, how do you communicate things? So S-bar, have you ever heard of S-bar? It's from the Navy. So you do the situation, the background, assessment, and recommendation. In other words, situation is, hi, my name's Spiro Antonitis. There's a patient I have to transfer to your service. He's just had surgery. He needs to be in the ICU. And then the background, the patient lost 5 liters of blood, etc. And I think he needs cardiac monitoring. The assessment is, I think he's okay, but I think he really needs ICU monitoring. And the recommendation, I'd like for him to be in the ICU. So you have to do all these things in a structured manner to make sure you don't make a mistake. The other thing is, before surgery, a preoperative and postoperative briefing, a huddle. So in football, you get together, you say, okay, this is what we're doing, we're running right. And then afterwards, the huddle is like, hey, why didn't you block that? So you made a mistake, and that's why we didn't get any yardage. So there's got to be constant huddles where the team gets together, comes up with the plan, performs the plan, and then after we affect it, we say what was wrong. And we do that in the operating room. We try to anyway. And the other thing is checklists. So the most common checklist is the airplane. The airplane doesn't leave the ground unless the pilot goes through the whole checklist. And we have a checklist. We have many checklists. Like, Jessica, what's your checklist? Do you ever use a checklist? Pre-op?
Pre-op.
You have the pre-op checklist, and in the operating room, they have a whole checklist of all the instruments that we use.
They're very common now in the ICU.
ICU uses checklist for the lines, right? Central lines, they use a checklist.
Everything.
Yeah.
And that dates from, I think there was a famous incident where somebody created a new airplane and they took off and crashed because they simply hadn't sat down and checked through what they were going to do on the flight, first ever flight for this airplane. There's a guy called Provost who uses that as an example.
We're from Hopkins. He wrote a book about it.
Check this.
The other thing is the surgical consent. Is when we get consent, we do it in a structured way, never under duress. I always do it in the office when they're relaxed. I let them read it. It's got to be legible. So I basically type it out. I complete it using the computer. And it's got to be simple language, and it's got to be very clear so that they know what's going on. And then before we do anything in the operating room, we go through the checklist and we go through a timeout where we're all huddling basically, and we go over our plan. So it's very important. And the biggest mistake people have is they don't pay attention to the timeout. That's the biggest mistake. And I think me personally, is they don't have a commitment to excellence. They're sloppy. And they feel it's not important. This is a simple case. Why do we do this? That's not the point. The point is we always do a good job. That's what we do, And so the other thing is, when we make mistakes, what do? Mistakes are common, and you can't go crazy over it. You have to accept it. You have to recognize it immediately. You have to apologize if you feel it's necessary. You have to create a new plan going forwards. So next, David, thank you for coming. Sorry, I'm remembering.
I have to leave now.
Okay.
Thank you.
Another important thing is, how do you deal with stress? Let's say you're in a stressful situation. I think surgery can be stressed. And there are many ways to deal with stress. And stress can kill you. It can make you depressed, angry. It can make you sick, immunosuppressed, all sorts of problems. So there's a couple things that I do. This is my plan to deal with stress. One thing is understand how I am. So first is breathing. So slow, methodical, deep breathing relaxes you. It tricks your brain that everything's okay. Vivid imagery, we're going to get through that. We're going to get to that later. Practice. If you do things over and over again, you don't have to think about it. It's in the part of your brain where you swing a baseball bat. Meditation, I think, is extremely important because it helps you train your brain to focus, basically. Not on good things, but on bad things. And then relaxing in steps. So, like, for example, you have to be relaxed when you do things, and you don't realize you're tense. One thing is when I'm under the microscope, I do it in steps where, okay, is my foot relaxed? Is my calf relaxed? Am I relaxed? Are my knees bent? And I'm constantly making sure that my whole body is relaxed. And then when you're relaxed, you do a better job. You're under less stress. And you don't realize you're all tight. You know, like some people, they've got a fist. Their hands, when they're negotiating, their hands in a fist because they're so tense. And then the other thing about stress reduction is worst case scenario plan. So whatever happens, you've got a plan. And when it happens, there's no anxiety involved. You've got the plan and you affect the plan. So you've got to constantly, that's the other thing about thinking forwards. And then the other thing is like vivid imagery. So I remember when the Ravens won the Super Bowl, I don't know if you guys remember, it was like 4th down. And just before this is just before the play, and Ed Reed said to Ray Lewis, he said, "This is what we do." You know, like this is, we stop the ball, this is what we do. So vivid imagery is very important. So what did they see themselves as? Did they see that Ed Reed see himself as some kind of victim or somebody who's afraid? No, he saw himself as a hero. This is what we do. We stop things like this. So the image that you have of yourself is extremely important. Another example of vivid imagery is my friend Pete Soteris. He says he treats every single patient like it was his brother, sister, father, mother. And you can trick yourself into really doing that. And when he used to work an ice cream truck in medical school to make money. And the person who owned the ice cream truck said, every single kid there, just try to make sure you act like it's your kid. And you can trick yourself into really doing that. So when you really feel that this person, like I'm talking to Jessica, I think she's my sister, there's things, it's more than just the thought in your head. Is when you have the thought in your head, you act differently. Your body language is different, the way you look at them is different, and you communicate not only through your words, but all these different things, your body language, your tone, a million things, and you can really trick yourself into really doing it. So you should do the same thing with like a coworker or a client or a man on the street. You don't treat them as some stranger, but you treat them like you would like a friend. And when you do that, it changes things. Okay, one more thing is anxiety. So what is anxiety? And anxiety is a very big, I think, a very big part of our lives, to control it and also to understand it in other people. It's feeling a worry, nervousness, unease, typically about an imminent event or something with an uncertain outcome. So it's sort of like fear. And a big part of anxiety is vivid imagery, again. So you can use vivid imagery in a positive way, but also a bad vivid imagery can kill you. It causes anxiety. The classic example is someone who gets on the airplane has a constant picture of their head of the airplane crashing. And that creates an incredible amount of anxiety. So vivid imagery is very important. Actors use vivid imagery to do a great job. So this is what's his name? Chevy Chase. That the actors, they be the character. They are the character in their head. And then they do a great job acting. So they don't have to think about, I'm smiling, I'm looking like I'm a nice guy, I'm showing my teeth. They're just thinking the vivid imagery in their head. So this is him. He says, you're at a sales convention and you meet Fiona, a beautiful new hire. So he's like, you know. And the left is, you realize that the woman at the corner is holding her raincoat and she's naked. So he doesn't have to think like, oh, I'm going to open my eyes. I'm going to like. He's imagining it, and he has a vivid imagery, and it does everything for him. So actors use it. The other great description is a book by Olivia Fox Cabane, which is great. It's on the charisma myth, and her book is How to Be Charismatic. And the basic premise is 3 things: show power, show warmth, and be engaged. And the way you show power and the way you show warmth is vivid imagery. So if you think you're powerful, you are powerful. So if you think like, I'm a big, strong guy when I walk down this, I'm like Hercules when I walk down this hallway, you do all sorts of things that you don't even realize. You put your head back, you make your chest tall, you walk straight. You do all these things subconsciously because you have this vivid imagery in your head. And also you can fake yourself into warmth too. Like you want to be warm towards somebody that you don't know. You just imagine that you're talking, to somebody you really care about. And then all of a sudden all these warm things come out of you through your brain. I won't get into that. So another important thing about life is being uncomfortable is you have to know that you're uncomfortable. This guy's a crazy guy with a Darth Vader mask, and this woman's obviously very uncomfortable. So there's a couple things. First is know that you're uncomfortable and accept it. It's like, oh, I'm very uncomfortable here, and I know why. Because there's a naked guy with a Darth Vader mask. And that's normal. And be okay with being uncomfortable. That's part of life. And if you're uncomfortable, there's going to be times when you're always going to be uncomfortable. And you have to be uncomfortable if you're going to expect yourself to grow or to do new things. So that's part of life, is being uncomfortable. And quite often I try to put myself into an uncomfortable situation, the new surgery, doing something with the left hand, just so I'm okay with it. Like I'm growing. We talked about meditation. These are the last two things, is just dealing with anxiety. Is Viktor Frankl is a concentration camp survivor. And a key point that he had in his philosophy of life is between stimulus and response, there's a space. Or another way he said is the last vestige of human freedom is the ability to respond to a situation. So when something happens to you, you have the freedom to react any way you want to react. That's the freedom that you have. You don't have to get angry, and then you don't have to get upset. You don't have to panic. Like, that is your freedom. And when he was in a concentration camp, he chose to be stoic, and he survived. And that was the last freedom that he had, was how to respond in a very extremely bad situation. And that's an incredible freedom that we have as human beings. And most people don't realize it, that you do have the freedom to do whatever you want. And what I do is I create vivid imageries, like when something happens to me, like, who am I? Like, I'm Hercules, I can deal with this. So you have this vivid imagery, and then you do it, you affect it. And the last point I have is excellence, is from Richard Feynman, who is a physicist in the Manhattan Project. And this was from a lecture that he gave in 1974 to Caltech. He said the most important thing is, the first principle is that you must not fool yourself, and you're the easiest person to fool. So what I mean by that is, and the other thing he always said is, he says, is you always have to bend over backwards to show how maybe you're wrong. Is you should never fool yourself with things, with learning, with taking care of patients, etc. Is that you always have to be constantly making sure you're not just doing something out of routine or rote, or because somebody else told you, because you think it's probably right. You have to be constantly judging yourself and criticizing yourself. Otherwise, you can make incredible mistakes. Does that make sense? And when people make mistakes, they believe in their own lies quite often. Okay, that's it. That's my any questions or comments? Excellence and reliability in surgery.
About checklists, I think we're perhaps moving here to creating too many pieces of paper. I got a patient, was in the ICU in Harvard yesterday. I got a patient moved up from the ER down here, and there was a stack of paper, literally 30 or 40 pieces that somebody had generated on the computer.
Bureaucratic checklists?
That sort of stuff, but it didn't really tell me anything about the patient. And you can spend so much time doing checklists, you don't actually do the thing that you're checking.
Right, it disrupts flow.
Yeah.
Yeah, I know.
So you have to retain a sense of proportion about that.
Well, yeah. I mean, there's a balance, obviously, and so there's just like, the benefit of the checklist is you don't make mistakes, and the airplane doesn't crash. But then the risk is the airplane just never gets off the ground. You're just sitting there. You have like a 3-hour checklist. You don't fly. Mm-hmm. Well, so what did you do? Did you talk to the person who made the checklist? That's the problem is with the hospital. The person who makes the checklist is not the one who uses it.
Yeah. Well, I think this patient was in the ER overnight because the ICU was full. So that delay meant that people were. I don't know quite why all these pieces of paper were generated. They didn't mean anything to me. And I find that different administrators saying, oh, let's have a form for this, let's have a form for that. And so the chart may be full of all these different forms, which are really duplicates of the basic idea.
Yeah, we're bogged down by
just one good idea rather than 5 or 6.
Yeah, excessive bureaucracy, and unorganized.
Yeah.
Okay, any other comments anybody wants to add? All right, thanks for coming.
The motivational talk.
A little bit.